Hi, I'm Anjali,
And I'm Martha.
and welcome to Public Health on Duty, where we talk to some of the most inspiring young minds in the Philippine public health system. Join us as we talk to our guests about their stories, learn about their career journey, and chat about their wins and everyday challenges. So, our guest for today is a public health professional with almost a decade of experience on public health policy development in the Department of Health.
Welcome to PhD, Rodley.
Hello, good afternoon to all our listeners.
Yes, hello, good afternoon po. Napaka-formal naman.
Good afternoon, good evening, and good morning to everyone listening.
Sorry, we just have to ask, what are your preferred pronouns?
My pronouns are he or him.
Right. And can you tell us briefly about yourself, Rodley?
Okay. Again, I'm Rodley Carza. I'm a nurse by profession, and I hold a bachelor's degree in nursing from the Forest University, Manila. I also hold a master's degree in public health from the University of the Philippines, Manila, where I also am taking my master's in health policy studies. Currently, I perform the role of the officer in charge chief of the Policy, Planning, Standards, and Research Division of the Health Promotion Bureau of the Department of Health. That's a mouthful, sorry.
So, Rodley, you mentioned that you are a nurse by profession. So, after nursing school, you went to the DOH already, right? So, can you tell us about that experience?
Okay, sure. So in my undergrad, I really had an interest in nursing research. So I sort of really appreciated the methods of how we do research in nursing. And one of my professors referred me to a fellowship program that the government is doing. At that time, it's with the Department of Science and Technology, but I didn't know that it's a partnership between the OST and Department of Health.
Right.
So when I applied for the fellowship, we were deployed in the Department of Health, and that's the first time, or that's my first exposure to public health, at least in practice, not in the academic sense.
Right.
So I was part of the pioneer batch of the research fellows in the Department of Health. At that time, I'm doing research in infectious diseases, young nurse, but working on research on infectious diseases, malaria specifically. So it's a totally new and different world than my training in nursing. And dun ako na-expose sa health policy, legislation, public health research specifically. And yon, from there on, sabi nga ni Ange, nagkaroon ako ng decade worth of experience in public health.
But that's interesting. When you were taking your undergraduate in nursing, you didn't intend to practice talaga nursing. You really wanted to go into research?
I intended to do practice as a nursing practice in the clinics because among the fields of nursing, actually community health nursing ang pinaka palpak ako. So it's actually surprising that I'm in public health now. But at that time, it was a time where nurses are highly in demand abroad. But it's clear to me that I want to work in the Philippines and I want to sort of make an impact in my own country first before going out. But definitely that's the more lucrative path to take. So the opportunity presented itself with the help of our advisors and mentors in research. Okay, so yeah, let's try it. Kasi the global market, the labor market at the time is not that good. I mean, job opportunities are also scarce.
I see.
So you're presented this opportunity, so I had to take it on, and it's also my interest, research, right? So and then from there on, I guess you can say that I fell in love in public health. Fell in love to public health. So yeah, it started my career in public health, that fellowship program, eventually. And eto, nandito na ako sa health promo doing policy work.
Right. Well, as you mentioned, it's basically your love of research that led you to the Department of Health. But you also mentioned that your first stint was on infectious disease research. Kasi syempre iba yung research on nursing, diba? Tapos you also intended initially to do clinical work from your work there.
Yeah. So I am third DOH as a research fellow na sobrang idealistic ko. And my framework of change is very clear. I'll do outstanding research. That research will be the basis of a policy or a program. And it will improve the health of the Filipino people. That's how I viewed my work in research. And that's evident in the research proposals that I intended to do while I'm doing the research fellowship. Kasi it's a bit experimental and clinical in the aspect, no? Pero that's where I also learned with the help of our mentors in the DOH na nursing research is also a different field than compared to public health research. So it requires a different set of design. Parang hindi siya yung typical na research na ina-apply mo sa clinics or sa clinical trials, for example. So doon na open yung mind ko na, okay, hindi lang pala confined sa clinical aspect yung pagkakandak ng research. So meron pala tayong tinatawag na health policy and systems research or implementations research na okay, malawak din pala yung field ng research and ito yung ginagawa to influence policy and decision making, not just the typical clinical research that we're used to when you're taking your undergrad in allied health professions.
Since you're already on the topic of research feeding into policy, might you be able to take us through the policy process in the Department of Health?
Sure. The two processes are interlinked, no? So research actually feeds into the overall policy development process in public health. So research specifically could be a source of the first step of policy making, which is problem identification and prioritization. So you can actually do research to identify what are the pressing concerns or issues that decision makers need to act on. So that's one. That can be based on research, but also that process can be based on more practical considerations, such as operational concerns or implementation issues.
Right.
That it might not be as systematic as research, but because you experience these operational issues or concerns, you know that you need to solve them.
Right.
So that can be part of the problem identification phase. In policy, there can be legal mandates as well that you need to perform. So whether if it's not a clear problem or it's not an operational issue, but there's a law or a legal directive that's mandating you to do this, then you have to do it because you're legally bound to, right? So those are the few examples of how you can identify which problems to prioritize in policy development. And once those priorities are an agenda, as we call them, are clear to you, that's where you move on to the next step, which is formulating the actual policy. So identifying concrete steps of how you will achieve a particular set of goals. So if it's a problem, then what's your solution? So ito yung phase na you identify policy options and alternatives, weighing them in so you know what's the best alternative to or policy option to recommend for the next step, which is policy adoption. So in the DOH, this is the step where we present this proposed policy to the EXECOM, Executive Committee of the Department of Health, essentially the USEX and ASEX of
the leaders of the
big
agency,
bosses.
the big bosses. And it's expected that when you presented them that you've done your completed staff work. So in policy, that means you've done your research on the policy options and alternatives. You've weighed in the pros and cons. You've done stakeholder consultation, or at least created a technical working group who will draft the said policies. And then if the EXECOM deem the proposal in order, for example. As in, okay, clear yung how it answers the policy issues, then that's the time that they typically approve the policy proposal. That's not the most challenging part of policy development because the challenge really is implementing it, enforcing it. And that's a totally different story, especially in our health system wherein it's devolved. So a lot of our policies are actually not implemented by the DOH. And I think that's not clear with the audience na, okay, may health issue, DOH ang may kasalanan. Hindi po kami yung fully accountable lang because as we implement our policies, there are a lot of entities involved. And typically that would be your local government units because our local government units, as mandated by the LGU code, should be responsible in the health provision of basic health services in the locality or in your area. So that's the complexity of policy implementation. So there are a lot of entities and stakeholders that you need to ensure that they will also do their part in implementing it. So that's national government agencies if it's a joint program, or local government units if it deals with provision of health services. And of course, as you implement it along the way, you have to monitor if your policy is doing its supposed objective or parang it's achieving its supposed goal. So that's when we do program implementation review. So every year, typically programs meet all coordinators nationwide and ask, what are the problems in terms of this policy, implementation of this policy? So we get insights on how they implement it in the region or how successful or challenging it is in their locality based on how different actors sort of implement the program, right? And policy evaluation can also be in a form of special studies. So researchers here have a role in shaping the direction of the program. So linking it back to the first step of policy development. So it's cyclical, but I don't want to. I just want to tell you na hindi siya necessarily linear. I mean, hindi siya sequential.
Yeah,
that's a term. Hindi siya sequential. So it can jump from one point to another. But essentially, that's how the cycle goes. You identify a problem and prioritize, and that will become your agenda. You formulate the policy itself and have it adopted by the decision makers, such as our DOH Execom, and then implement it and evaluate it if it's achieving its goal. And then if it's not, then you're back at the first step. Okay, what's the problem? How do we solve it? It's a long story.
Yeah. Kaya naman pala isang dekada ka na sa DOH. That seemed like such a long process to go through.
Napagod ka ba?
So since season 1 is all about the COVID-19 pandemic, and when the pandemic was declared, there were policy problems left and right, no? So what were the policies you spearheaded during the height of the pandemic?
Well, when the pandemic started the first case was announced in December, right?
Right.
I was still performing the role of the executive assistant to the secretary. So our focus mainly is to ensure that that the different operations are, sustained and strategic directions are implemented. And when I think the height of the pandemic really started in March when the lockdown was announced. So during that time, that was also the time where when I was appointed OIC of the Health Promotion Bureau's Policy and Technology section. And we were in charge in developing policies on COVID, particularly in prevention. So I was part of the team our team developed the minimum public health standards policy, and eventually its various iterations in different industries, such as the film industry, sports industry, gaming industry. So we're heavily involved in in setting the direction on COVID prevention because we started the minimum public health standards
Right.
policy. We also work on active transport, surprisingly, because there were a lot of mobility issues at that time. So we found a
Right.
policy window for active transport or biking for layman's uh, appreciation. So the creation of bicycle lanes, we were the team behind that, of course, with the support of different agencies and civil society organizations. And simultaneously, we're working on UHC policies. If you remember, in the UHC Act, there is a particular section on health promotion, and that mandated the issuance of a lot of foundational policies on health promotion, such as the Health Promotion Framework Strategy, Participatory Action Research, and Health Impact Assessment. So we're doing quite a lot
Right.
kahit pandemic. So COVID and UHC, the work must go on kahit pandemya. So it's a challenging time, but we managed to pull through.
Yeah. I guess just for the sake of our listeners, what is health promotion exactly? Like, I came from technically a public health bachelor's degree, but I don't ever remember actually studying health promotion the way the Department of Health does it. So I think a lot of people will benefit if Rodley can explain to us real quick, what is health promotion?
Okay, that's a good question. Health promotion is essentially the process of enabling people to have control over their health. So it's different from other fields of public health wherein you're confined with the different building blocks of the health system. But in health promotion, you try to influence something beyond that, which is the different social determinants of health. So I think that's what's unique with health promotion. We're not confined in influencing the health system, but also
Right.
influencing other sectors, transportation sector, economic sector, education, etc. So it's a bit broad, but essentially the goal is people will be able to control or will be empowered to control their health. I think yun yung misnomer or misconception in health promotion, that health promotion is just educating someone. It's just letting them know, and then they will do the desired behavior that you want. But in health promotion, we go beyond that. We try to influence the environment so they will be able to actually do what you ask them to do. So kung gusto mo siya mag-jogging, pero wala naman siyang parks na pag-joggingan.
Yeah.
Kung gusto mo siya mag-exercise, wala naman siyang open spaces na pwede siya mag-exercise, then he will not be able to do the desired behavior that you want them to do. So that's the scope or the gamut of health promotion in public health.
Right.
Oh, hindi practical mag-jogging sa highway.
True.
Hindi practical mag-bike sa highway kung walang protected bike lane. So yeah, that's health promotion.
And I guess aside from structural changes, it also entails, your work entails also a lot of negotiation with the other sectors. Surprisingly, the health sector, what I'm realizing now, has a unique position to actually shape how other sectors, are implementing their policies, are, instituting changes so that it's promotive of the health of the people at the end of the day.
Correct. And I think it's some people would describe it as health versus economy, because at times yun yung kailangan mo i-negotiate, health of the people ba or the economic environment, because it will dictate the situation. But actually, health is economy is health and health is economy, right? So
Mhm.
if you're poor, how can you be healthy? And if you're parang vice versa, if you're healthy, how can you be productive economically?
Right.
So I think that's one of the negotiation that you'll have to that you will encounter in your public health practice one way or another. Na there are decisions that sometimes mukha siyang sacrificing one over the other, but actually you have to sort of ensure both, right?
Since, as you mentioned, practically no one knew about the novel coronavirus during that time. And even us inside the DOH, nakatingin tayo to our infectious disease experts, no,
Mhm.
who are unfortunately outside of the agency. And so, can you share with us, Rodley, so how did the DOH, no, bring those experts to the table?
That's a good question because an observation that they're actually outside of the DOH.
Mhm.
But I think it's also it has a certain beauty in it. Na there are not they bring in different perspectives in the discussion and decision making, and
Right.
at the end of the day, they must agree on something that they will recommend. So that balances the power dynamics between the government and non-government who are actually experts. And our primary platform to ensure participation of these stakeholders or these experts is through technical working groups. So we do have a lot of technical working groups in different fields of public health, epidemiology, helping us in gathering the evidence and parang setting the direction on how the COVID response will be. So I think aside from literature and global recommendations from the WHO and other known authorities in health, such as the CDC, US CDC, we relied heavily on expert opinions
Right.
and experience of these experts in the clinical setting. So that help us a lot in decision making, and of course at the time there are emerging evidence already, so publications or journals that are awaiting peer review but that they're already accessible, so you can see the results already and somehow form your policy on based on data, on available data, because at the
Right.
time there's no established data yet on COVID-19 because it's a novel thing.
Right.
Mhm.
Super interesting no? Kasi Rodney mentioned na our experts are actually practicing clinically. So they're not only infectious disease experts, they're actually in the hospitals dealing with COVID-19 patients. So ang ganda lang na it kind of like grounded our health policies, diba? Because as Rodley explained earlier, diba, it has to start with a problem. And these people actually see the problem on the ground.
I'm curious though, like, was that always the norm that DOH brings in technical experts from outside the department to help like navigate diseases or inform policies maybe?
That is. And the policy process in the department, I felt, is really participatory of concerned stakeholders. So it's not new that we have clinical experts or infectious disease experts providing opinions or recommendations in our policies, but also in different fields, such as in NCDs or in governance, wherein we create technical working groups. If they're not part of technical working groups, they take part in the public consultation of the policy, wherein they can raise potential operational concerns because they are on the ground. They know what's really happening on the ground. So I think that brings back that makes the process holistic and not really a process that is dictated by an ivory tower
Mhm.
na hindi nabulag sa what's happening on the ground. So civil society organizations and different stakeholders, or such as NGAs or LGUs, really bring in the experience, the perspective from implementers, and making sure that the policy is something that we can implement and realistic, no? Hindi naman suntok sa buwan na may policy ka nga, but no one else can actually implement it.
Cool. Pero question lang, when you say public consultation, you mean public consultation?
Pre-pandemic, public consultations are really public consultations. Like we hold events to just go through the policy, proposed policy line by line, and everyone is pretty much welcome to attend, especially if you're an identified stakeholder.
Yeah.
So if you're a patient group, for example, of particular program, then you're invited. But
Mhm.
if you're just interested, a practitioner that's interested, you can probably participate. That's pre-pandemic.
Mhm.
And I think that's something that changed during the pandemic because, of course, we cannot hold the mass gathering events.
Uh-huh.
Right.
So the form of public consultation has to change. And that happened na virtual na siya. So you see in the Facebook or in social media channels of the Department of Health, you see different bureaus of the department holding virtual public consultations
Mhm.
wherein people, the general public can just join the Zoom meeting and participate in the discussion on the
Right.
public. I think we did that with a lot of our policies in health promotion, and that changed that sort of democratized
Right.
the process of public consultation because you're now not confined with the geographic location. So whether I'm in Basilan or in Batanes, I can join the public consultation on healthy communities because I don't have to go to Manila.
Rodley, you've been talking a lot about the involvement of different sectors, no, and which makes policy development very holistic because di alam ng iba, essentially everyone can participate in the policy process. But at the end of the day, di ba, parang we have to measure the successes of these policies. So, how do you measure, or what for you is a good policy? How do you measure that? And what are some of the components of or characteristics of a good policy?
Okay, I don't want to be technical on this, but essentially for me, if the policy is able to achieve its supposed goal or objective, then it's a good policy. At the end of the day, you want the policy implemented and you want the policy to be able to achieve what it aimed to do, right?
Yeah.
So what it aimed to address.
So, why do you think nursing graduates or allied professionals should join public health?
I think the opportunity to impact lives at the scale that is not available in clinical setting is something that undergraduates, not just in the nursing profession, but across allied health professions should consider. The policy space in the Philippines is a bit skewed to medical professions. And I think this signals that, and in the past few years, it already signaled that the DOH is open to bringing in other professions, especially in the leadership space, at the leadership level. So nurses, medtech, bio, and even other social sciences that are not essentially allied health can actually enter DOH and influence how the health systems work. No? So, but yeah, for allied health professions, we're conventionally confined in a space wherein our work is true or is within the four corners of the health facilities. And I just want our listeners to know, especially those who are undergraduate in nursing or other allied health professions, that your career opportunities are beyond that. Parang you can influence health of your clients beyond the four corners of your health facilities. I'm not saying that the clinical aspect of health is not important. It is, because whatever we do in public health, if the services are not available in the clinics,
Right.
it's also not ideal. But just want to let our listeners know that there is career in public health, and whether you're nursing or a medical doctor or med tech, you're welcome in the department. There's a place for you in the Department of Health or in the public health sphere to influence how the health system works. So I think the health system now needs a lot of managers and implementers. And maybe that's the value that you will add in the public health space, in the field of public health. So yeah, consider a career in public health, and it will really give you a platform to influence a lot of lives. Hindi lang immediate. I mean, hindi mo makikita gumaling agad si Ange from her condition. Hindi mo, see,
Are you sick?
because it's a work of public health. She's not sick because of public health measures.
Right.
Oh, yes.
But hindi mo makikita.
Thank you, health promotion.
Hindi mo makikita agad na gagaling siya, or yung direct benefit of health services that you provide. But I assure you that your impact will be felt in the long run. So perhaps the future generation of Filipinos will be thankful that Ange did open space, that Martha did gender health. And di man nila makita ngayon yon, but perhaps the future generations, hindi nila alam na si Ange at si Martha nagawa nun, but they felt that change in the health system.
All right. Thank you so much, Rodley. Sobrang dami naming natutunan. We're really glad na you joined us here at Public Health on Duty. Your story has been very inspiring.
Yes, but now it's JQW Book Club time. So this episode we have for you, Which Country Has the World's Best Healthcare by Dr. Ezekiel J. Emanuel. So that's the million-dollar question, isn't it? Is it Denmark? Is it Australia? Maybe Canada? But Dr. Emanuel went ahead and did for us the hard work of comparing several countries' healthcare systems in areas such as the history of the health system, the extent of coverage, financing, service delivery, human resources, and price regulation.
If that book was the million-dollar question, let's kick it up a notch and answer $1 trillion question. We also invite you to read The $1 Trillion Revolution, how the Affordable Care Act transformed politics, law, and healthcare in America. Also by Ezekiel J. Emanuel with Abby R. Gluck. It tackles the big questions about Obamacare, which many would say is the biggest U.S. healthcare system overhaul since Medicare and Medicaid. In an imperfect healthcare system, what did we achieve? What didn't work? Public health experts, lawyers, economists, academics, and politicians weigh in on the policy goals, implementation, legal constraints, impacts, and lessons from this landmark law in this book. So make sure to check it out. Thanks for listening to this episode of Public Health on Duty. You can find us on Spotify, Apple Podcast, Google Podcast, YouTube, and anywhere you get your podcasts.
Public Health on Duty is a joint production between Epimetrics Inc. and Big Baby Studios. Dr. John Q. Wong is our executive producer. Editing and hosting by Angeli Magdaraog and Martha De La Paz. Our producers are Abigail Tan and Antoinette Mendoza. Sound engineering and original theme music by PV Nicolas.
You can find out more about Epimetrics at www.epimetrics.com.ph or at EpimetricsPH on Facebook and Instagram. This has been Martha. You can find me on Instagram at _callmemartha.
And I'm Angeli. I am not on social media, but you can catch Martha and me on the next episode of Public Health on Duty.